Okay, so let's take just a couple minutes and talk about autistic masking. What is it? Well, it is a conscious or unconscious suppression of autistic behaviors that with the intention of appearing neurotypical, and it's generally done as a means to fit in. It's important to note that everybody masks to some degree, not just autistic individuals. Therapists do it all the time. I always joke that we therapists, we consciously and unconsciously develop a therapist voice, right? Because we want to really come across as very non-threatening, non-judgmental to the clients we work with. So whether it's a conscious thing early in our careers, and it probably just becomes unconscious as we continue to work on, we go into our therapist voice mode. That's a form of masking. When you go into who you are at work versus who you are at home, you might be different. That's a form of masking. For autistic individuals, it comes with a higher level of intensity and importance because it's about trying to fit in. I describe masking as both a life preserver and an anchor. And what I mean by that is masking is absolutely a survival technique. It is a life preserver, that it helps autistic individuals fit in society, not stand out, not get bullied or picked on, to feel like they're better understood, right? And they have better connections with other people. That's a really good thing. The downside is, though, that it comes at a cost. It can be extremely taxing emotionally to mask. It can be exhausting at the end of the day. If you've had to mask all day, it really can wipe somebody out. And really, on a deeper level, when we think about it, at its core, masking is sort of telling ourselves that our true self is not fit to be seen by the world, right? Which is never a great thing to be telling ourselves on a very deep level. So again, it's important. It is a survival technique, but there is a cost to it too, and it's really important to know that, right? It's important to know that not every autistic person can mask or wants to mask. They do it for a variety of reasons. It's obviously a coping mechanism at times. It sometimes is completely unconscious and completely unintentional. And again, it can be pretty detrimental to an autistic individual's mental health and emotional health and even physical health if not handled and coped with and managed in healthy ways. Okay, so what does it look like? Well, pretending to be interested in a topic that maybe they're not interested in. For autistic individuals, sometimes they will struggle more than neurotypicals to feign interest in topics they're not interested. So learning to do that so that they can be a better friend or fit in more socially is something they might do. Like I mentioned with us therapists, it might be using a different voice, right? Or a different voice even in different social situations. Having a script for conversations is masking. This is something I do with a lot of my clients who are neurodivergent, is we talk about the various situations that they find most stressful socially, and some of the social dynamics might be very hard for them to understand. So what we do is we try and narrow it down. What are some kind of preloaded scripts that you can have in your mind that you know work in these situations? And you might not even have to really understand truly intuitively why they work or what they do, but just knowing that, you can memorize that and do that. For example, with small talk, when I work with clients on small talk, I often use the stoplight analogy of red light, yellow light, green light, that people who are neurotypical intuitively know that when we first meet somebody, we don't just jump to asking super personal questions because that might be a little off-putting. For somebody who's autistic, they might not intuitively know this, and they might not even intellectually understand at first why that would be off-putting. So helping explain that to them and just kind of helping them get a better sense of what are the green light, yellow light, and red light questions and when they're appropriate. Person doesn't need to truly understand all of that. They just need to memorize and know when to do these things. But a lot of autistic people, when you talk with them, they do understand these. They're very intelligent, and even if the social cues and things don't come to them naturally, it's not like something they can't learn or can't memorize to do in certain situations. What else does masking look like? Constantly overanalyzing yourself, being that tape in your head, that kind of narrator in your head, thinking about how you look, how you sound, how you're sitting, if you're making eye contact enough. Because for most autistic people, they've been, either bullied or teased or pressured in ways that make them feel like they're not normal or they're not fitting in. So they desperately try and always kind of assess themselves to make sure they aren't sticking out. Hiding behaviors that might be considered socially acceptable, like the stimming behaviors, or I should say socially unacceptable, like the stimming behaviors I mentioned earlier. So I think it's a little bit more acceptable now. People are understanding these, but if somebody's in a classroom and they're doing some stimming that other people might see as odd or even disrupting the class, they might have to work on masking that and hiding that. And it could be about hiding their special interest, because maybe they've been told or have been rejected before because they started info dumping, as we call it, about their special interest on somebody who wasn't being very receptive to that. And another thing that masking can cause somebody to do is ignore their own sensory needs. Other things that it can do is a lot of autistic folks will practice facial expressions and body language and think about social interactions ahead of time, trying to act normal, and forcing themselves to make eye contact, socializing when they don't necessarily want to, paying attention to how other people act and maybe imitating that as well. They can often fall into a pattern of being very people-pleasing as well. So those are just some of the things to look for when somebody is doing masking. So why does it happen? Well, I talked a little bit about this already, but to avoid being misunderstood, to avoid being bullied or made fun of, to feel more successful at work and school, making friends, to try and reduce stress, even though sometimes it can actually cause exhaustion. It can reduce stress. To feel safe, I think that's a big part of this, right? To feel like the world is safe and more predictable, that we're not going to be rejected, to avoid feelings of embarrassment. It can be a survival skill, like I said, and absolutely a critical one for autistic folks. So, and like I said before, it might not even be intentional, or they might not even be conscious that they're doing it. Okay, so it's important for autistic folks to unmask, right? Because it is, like I mentioned, it's emotionally taxing. It can be very draining. So how do we do that? Well, we spend time alone. We spend time engaging in our special interests. We spend time talking with our special people who don't mind when we info dump all about our special interests on them. We might rewatch some of our favorite shows or reread our favorite books or comics, things like that. Having a sensory-friendly, safe environment at home is really important, even if it's just like a corner of a room or a closet where it's dark and there's, maybe a weighted blanket and some comfortable stim toys, but nothing overwhelming in terms of sights, sounds, smells, things like that. So having a place where you can just go and decompress. Asking to use accommodations and advocating for themselves. This is something that can be tremendously difficult for autistic folks, is to advocate for themselves, because they were raised in a world where in many ways they were told these different messages throughout their life that they're not supposed to do that, right? Or they were ignored, or they were told or felt that they weren't important enough to do that. So a lot of the work I do when I'm working with neurodivergent individuals is about just teaching them how to advocate for themselves better and when and how to do that. You can also mask by allowing yourself to allowing yourself to stim as much as you need to, by not forcing eye contact, by just really trying to be in an environment at home where you're safe, where you can be truly yourself. And again, by unmasking, this is going to help a autistic individual to recharge.